ke English. A o tobetsa 4 ke Sepedi kapa Sesotho. A o tobetsa 3 ke isiZulu or isiNdebele. A o tobetsa 2 ke Afrikaans. A o tobetsa 5 ke Setsonga or Tshivenda. Re di tshwere akere. 1 ke English. Sepedi kapa Sesotho ke 4. isiZulu or isiNdebele ke 3. Afrikaans ke 2. Xitsonga kapa Tshivenda ke 5. O molomo tobetsa yena nyakang akere. So that re kgone ho tsamaya mmogo. Dumelang hape. Lotshani. Okay. Leina la ka ke Rebecca Digamela ke chairperson ya Health Portfolio Committee ya Gauteng ke Health and Wellness. Very emetse at least re be more ka mo before re ka start akere. At least holo itletse re start a meeting wa rena today. Before we can start go ya gole, ke nna Rebecca Digamela, I told you, ke tlo dula fatshe and then members that are here ba tlo di introducer so that le tsebe gore go tlile bo mang mo akere. Yeah.
Dumelang batho ba bagolo, le kae? Leina la ka ke Maphefo Mogale Letsie, le nna ke leloko la komiti ya Health Portfolio Committee. Thank you.
Dumelang. Lebitso la ka ke Boitumelo Makgene. I'm a member of the Committee ya Health and Wellness.
Ke a leboga. Maloko batho ba ba re thusa mo komiting le bona ba tlo introduce gore setšhaba se tsebe gore go tlile bo man today mo akere.
Sanibonani igama nokwazi ngidi ngisiza i-portfolio committee ngiyabonga.
Sanibonani uNondumiso August ngisebenzisana naleli committee ngiyabonga. Sanibonani uNondumiso August nami ngisebenzisana naleli committee ukulisupporta ngiyabonga.
Dumelang bagolo, lebitso la ka ke Maggie Mokonoto, ke researcher ya Portfolio Committee ya Health.
Ngiyabulisa kunonke igama nguAsanele Mginindo lisebenzisana necommittee lena yakwa health. Enkosi.
Re a leboga ba bang ba busy ba re bereka le bona ka mo and then mara ra tswela pele. Mahareng ha rena re na le Department of Health ya Gauteng because ke bona ba tlo arabang di questions tla tlhalosa gore why re tlile today after the introduction. Over to you. We've got Mr. Ndima, ki the CFO, ki the leader ya delegation. They must introduce themselves and whoever they are having there.
Sanibonani, igama nguMasibolekwe Ndima, and I'm the acting CFO for the Department of Health.
Rishile, Bitorami Naibasanwa Kabaloi, I'm the DDG for Corporate Services ka Department of Health.
Nihamba na bubani Mr. Ndima.
That's Mr. Mtumune Piti. He's our district director, chief district director for Tshwane.
Okay, thank you, Mr. Ndima, for the introduction. Ka ntle le ho senya nako, le kreile sa o ja ke re ko tlase moo. Ba le file sa o ja ke re. Okay. Today re tlile because before ke ya re tlile. Re na le di apology. Re na le apology ya other honorable members, member Duplessis, ke apology a ka se kgone ho ba le rena mo meeting. Le kreile dilo tsa interpreter kere. Le di kreile. Ba sa le kolota. Emisa matsogo mo ba le kolota because itlo English itlo ba entshi gore re ska kra re toma maleme a kere. Mara polelo tse di kaofela di dumellegile mo meeting wa rena. Ba distribute.
Yeah.
Oh, okay. Yeah, the apology ke member Duplessis, le member Bloom, le member Mfikwe, le member Khadebe. Ke di members tsa committee ba ba ka se kgoneng go ba le rena mo meeting. And then from Department of Health, the apologies ke MEC Komora Lehuku a ka se kgone go ba le rena mo meeting. That is why Mr. Ndima ili yena a leader delegation from Department of Health. And then acting HOD, Mr. Malotana Leena, will not be able to be with us more meeting. Marababaling, at least the senior management or department to tusa waraba the questions there the post delay. So and then le agenda le tshwere ke re mo. So re boletse gore ke rena bo mang. And then ke tlo ya ko tabeng ya gore why re tlile mo today. La bona mo re ngwadile mo gore investigating factors influencing lack of access by the township entrepreneurs in supplying medicine and medical equipment to health facilities in the Gauteng province. Akere di township entrepreneur rena ba ko township a re kgone go supplya ditlhare a re kgone go supplya di equipment ko Department of Health mo Gauteng. So ka 2021 rena tswele ka committee se le ra tlisha question e le bona mo gore why township business is a kgone gore le yona e tsenelele e supply ditlhare le di metšhini ko dipetlele. So and then ra ba le di resolution ge re ba sena gore araba gore rena o ya ko pele re kopela gore go be le 1 2 3. So ke tlo bala mo ka sekgowa because re ngwadile ka sekgowa so that re kgone go tswela pele. During the deliberations on the analysis of the budget vote 4 report on the 2021-2022 financial year, the committee raised a concern that local township entrepreneurs lack full access to supply medicine and medical equipment to health facilities. Le ka ibala mo di screening ke ya tlhahela le lena le kgone go iponela yona ke. So it is on this basis that this topic was generated and it was explored. Le kreile di toloki emisa matsogo ba ba sa kreya ke ba bantši ba ba so kreyeng a kere. Yeah, whilst noting the presentations and deliberations that took place with Gauteng Department of Health, the funding institutions within Gauteng province and the stakeholders were present at both sessions. The committee was concerned with the accessibility of opportunities by township entrepreneurs to the medicines and equipment supply. The market was noted to be characterized by high barriers of entry, with the old players having ownership of the market. Old players, kuri ba le leng kgale bona, ba supplier, ba continue our supplier, our new entry, yeah, especially our own people in the township. Black women and youth-owned companies were noted to be facing serious challenges in terms of breaking through into this market. So, bomme, bona le young people, ba gatelegile le go feta gore ba kgone go tsenelela market o. It was therefore crucial for the department to consider revising some of the terms and provisions to review some specifications to allow black-owned companies some degree of access. While noting the above, it was also important to mention that in instances where black-owned companies have an obligation to deliver, the standard of quality and performance tend to be low because the services required are very technical in nature. Further, subcontracting is a challenge because there are very few skilled companies from the township. The committee resolved that the department should provide detailed strategies to be implemented. At that time, it was by 31st January 2022 on the following. The awareness programs or workshops to be coordinated to create awareness of the funding programs that township entrepreneurs can benefit from, to also provide education on the type of requirements that are needed to qualify for such. Plans to review procurement policies, including the total overhaul of the department's procurement unit and policies, since most blockages emanate from the procurement processes. Further, to allow for flexibility in the supply of medicine and equipment. To coordinate training programs together with SAPRA so that township entrepreneurs can be able to improve and meet the required standards. To subcontract or create regulations on partnerships between those township entrepreneurs and bigger experienced companies to share and transfer skills and knowledge, and strategies to be put in place to ensure transparency in procurement processes and the payment of service providers within the specified 30 days. Yeah, that is all what I wanted to share with us so that re be le background ya re go tlile bjang re tle ka topic e. So all of us, we now understand hore township entrepreneurs are benefiting from supply of medication, and at that time budget the Department of Health in Gauteng was 18 billion per annum, and that budget was benefiting mostly multinational companies and the old role players, as the report is indicating. So Rina, as a committee, township economy, these committee members, we wish to see township economy leona benefit from this amount of money, 18 billion ka 2021. Maybe this year because every year budget year improve. So that is why we want to the department how far are they in terms of implementing those resolutions that we have given them, where township economy leona benefit from Department of Health. Akere re a utlwana akere setšhaba re mmogo akere rena re lemogile gore township economy e ko morago, or batho ba township ba ba nyakang go dira kgwebo le Department of Health mabapi le go tlisa treatment ko dipetlele kapa metšhini e berekang ko dipetlele go a shorta. Ke ka lebaka leo re tlileng mo lena le feeling free ka obane re tlo fa Mr. Ndima and DDG Baloi gore ba re etelle pele ka gore ba ile go pele bjang ka taba e re tlileng ka yona gore lena le setšhaba le bone gore re ya pele bjang. So ka nako e because nako bile e šetše re eme ka phefong ke tlo handa over item 4 to Mr. Ndima Gauteng Department of Health. Over to you, sir. Sis.
No, thank you, Chair, and good morning again. I think my presentation is in English, and okay, all right. Thank you, Chair. I think I'm ready. Okay. I think, Chair, when we were preparing this presentation, we looked first at a number of concerns and questions, and mostly they talking to the access of business opportunities and how small companies can emerge and participate into our economy. So I will be responding to those questions and also maybe providing these access solution, others even into funding in businesses. So the first one, Chair, we have an entity that is called Gauteng Enterprise Propeller, which assists SMMEs or small, medium enterprise companies with funding. Now, this GEP is an entity of Gauteng, and people who have ideas and programs around starting or establishing business where these businesses require funding, this is the entity that assists us because it's mainly meant for that, because we know that banks are not easy in other funding models to assist small companies whom have no credit record. Some of them have no property to even make that as a surety. So I think government has then put this entity to assist specifically in that area. So one of the things that we have noticed, Chair, to be a failure for small businesses to obtain a loan or funding through the GEP or Gauteng Enterprise Propeller is the standard of business proposals that are made, and most small companies are failing to actually put viable business ideas that will ensure that whatever the GEP is putting, it will come back, or the business after some time when it's operating will be able to pay. So one of the suggestions that we've made to the CEO, Mr. Saki Zamtaga, is to maybe there is a need for an awareness chair through Ntirisano, that where GEP can come, because Ntirisano deals directly with community-related issues, and they can explain their requirements, and they can explain what is it that type of business proposal that they're looking for. So, but this has been common that many small companies are declined based on not responding or put what is required by the GEPM. So, Chair, we have also had a question that says, what capacitation training solution in existence as this will assist to empower those that are in disadvantaged background? So there's a program that GPT, Gauteng Provincial Treasurer, that they normally run because they are the ones that deals directly with central supplier database that controls as to how to make one to be able to tender with government, specifically with Gauteng government. So they run this session as well through Ntirisano. But what we have started, we're going to start as Department of Health and Wellness. I'm going to go personally on road shows where we will speak to communities, and we will do this in 5 regions, or in 5 corridors. Because one of the things that we have noticed is that the same CSD does not allow us, Chair, to actually make an impact to communities, because you'll find somebody who's in Polokwane or in Eastern Cape or in Mpumalanga has an address in Joburg. So if we're giving business to companies in Joburg, and when we pick that from the CSD, then it's quite difficult, because the CSD has already made verification. It's quite difficult to know, no, this person is actually residing in Mpumalanga, but has a business here in Cullinan. So it's a very difficult task to verify. So what we're doing as a Department of Health, we'll go on these road shows where if we come to a place like this, we would want to get a list of all registered companies for people with disabilities, for youth, for female, and also for military veteran. So when we do that, it will assist us to actually, when we respond in giving out business opportunities, that we can say, there is a pool in Cullinan. This activity is closer to Cullinan, or it's happening in Tshwane. Let's also send invite, because we would have come here and actually get the actual list. And maybe Mr. Makola, to make this thing practical. Mr. Makola is there, Peter, so that we don't waste time, because we have come to Cullinan. Maybe you can get a very nice clean sheet. Those who have registered businesses can actually list those businesses now, so that we can be able and take them to our database. But our database is controlled by Gauteng Provincial Treasury. So even if we take your business name and your numbers there, please ensure that you are registered to Central Supplier Database, because that's where we make invitation for people to do business with our government. So you can stand, Peter, so that you can see Peter. Those who have registered businesses can please do come and, Peter, don't make deals, give him something, or just the name of the company, the address, and also the telephone number of the contact person. We try, Chair, not to allow opportunities of improper relations. So just don't even take Peter's number. That list is in good hands if it comes to me. So another question that we had was how and why targeted groups are reached through department's procurement processes so that everyone can get an equal opportunity. In our department for this new financial year, Chair, we have targeted to say we have over 400 RFQs related on the procurement plan. We have then broken down into percentages that are priorities of the Office of the Premier, where we say this particular percentage is for women, this particular percentage is for previously disadvantaged companies, for military veteran, for people with disabilities. And we also want to urge people with disability. It's an area whereby it's going to be a bit difficult for us to verify. Please, any form of certificate or recognition, and I'm not doing this to classify you in any way, but we are avoiding whereby anyone will say I have a disability without any form of evidence, because we want to target that particular budget to go to people with disability. So, as I explained, Chair, for us to impact with communities, we will do this roadshow, and we're taking this opportunity in your meeting, after this meeting, for Peter to create that database that will take it to office. And we'll ensure as well, it's something that we do whereby if you get a business within the department, we'll try to rotate, because we believe that there's thousands or if not millions of people who've got registered business that want business. One of the things that we have picked up in years ago is that where you have only one company that is rotating around the department. So we have a control that we have placed whereby if you're going to go and get a new opportunity, there is a streamlined check to say, has this company did a business with us when? At least you should have, for us to give you a second time or second round, you should have done a business with us maybe in the previous year. I mean, you can't do business with us last month and we give it to you again next month. So it means we are not rotating the opportunities and we are not responding to the economic vulnerabilities in Gauteng. So the other question that was asked was that what kind of awareness or roadshows that are done by the departments. We always take an opportunity to the Interesano program that is run by the Office of the Premier, where we send some of our delegates to go there and explain as to how one can get business with the department and how one can get employment. I've got DDG of Corporate Services next to me. One of the things that the Gauteng department is doing, there is a portal called e-recruitment, and I will urge especially the youth and those that are unemployed to visit that, because by now everyone has a smartphone. And the way the system has been created, it has been created in such a way that you can make a job application using your phone. You don't need a laptop. If you've got your scanned documents, wherever in your drive, you can utilize that system. So it's one of the systems that are designed to respond to communities that are far from our offices in Joburg, so that we ensure that we respond to the entire Gauteng. So in terms of employment opportunity, it is there. Not only that you have to buy Sunday Times, but do visit that e-recruitment portal. It's under the Department of E-Government. If you go there, it will show you all the departments that we have in Gauteng, and you can visit each and every department to see if there is no opportunity. So, also, there is a regulation that has come in 2022, Chair, and I think politically, you guys must take this up and find a way maybe to correct this. But as the department, we are responding into this matter, whereby there was a judgment that from now on going forward, our government is not allowed to actually put 30% of its budget to respond to previously disadvantaged to black-owned companies. But as a department, we have taken a bold stand, and I've written in a policy in my unit to say we will continue with these elevated priorities as the department to respond to black-owned companies, because we all know the history of this country and how the economies of scales are responding boldly. But it's something that really is a disappointment because we believe the issue of 30%, whether it's in construction or any form of business that is brought in areas like this, companies or local companies must be given an opportunity to tender or to work in those particular programs. But as a department, we have put a policy because the judgment says that you can put your own priorities and will not deviate to our priorities because we still believe that our black communities are still suffering from poverty, suffering from equal opportunities. So, Chair, that brings to the end of my presentation. I've not been smoothing the slide. And thank you so much, Chair. Thank you.
Thank you very much, Mr. Ndima, for those responses. I hope Sichaba Sekwadile, then I hope Leta Khona ho botsisa di question maelana le the response that Mr. Ndima has given to what we put forth to them as a department. So, who explain the opportunities for young people, for women, for people living with disabilities, and those who also want to respond to Ori Baba Nalidi company, later you go to see Mr. Makola, and then ele mofeng me batla thusa hore ba le ba di process le be go database mara le lena le tsamaile lo register your companies with the department treasury so that they are benefit going forward. So kantle le go senya nako, I've got two honorable members here. Ke tla fa bona chance if they want to say something. Ke chance ya bona, and then mara otherwise lena le monyetla wa hore le tlo bolela hore le bona eng le suggesta eng go iwe bjang pele. Akere ke meeting wa lena le lena. Yeah, so Member Litie, is there any comment after the presentation by the department?
Thank you very much, Honorable Chair, and ke le dumedishe gape baagi. Re amogetse a presentation from the department. I think Chair o tla tlhalositse gore ke di concerns tse re beng re na le tsona as a committee. And from the presentation, there are a few things that I'm picking up, Chair. Maybe that might need the department together with maybe the economic development department to look into. For instance, the criteria that they use in terms of funding for SMMEs, the stringent criteria that the presenter would have spoken to, and of course also appreciating releboga department gore ba beile loto la bona fase gore come raining or high waters ba sa ikemišeditše gore rakgwebo potlana ba ka kry-a sengwenyana mo departmenteng. I think the presenter is saying to us, Chair, as political leadership, we should be taking it up, and I think it's still our responsibility to make sure that we make things easier for them as they try and help the community tša rena. So ka bokopana, Chair, ke leka gore re kry-ile presentation responding to the issues tša rena. Le nna ke lebeletše go kwa go badudi gore bona ba di bona jwang. Matsapa e ka ba di a tšea ko kae, maybe ge re le mo re tlo ba thaetša tlo re thušang gore re kgone go kgoboketša dikgopolo ge re ile go bolela le di-department tše dingwe le ka mokgwa re ka bontšhanang ka tšona re ka gore ba tšwelele pele ka go benefita mo departmenteng. Ke a leboga, Chair.
Re a leboga, Member Litie, for that input. Lidi Road Show are coming so that re be more educated about what is available that we do not know as community. Member Makane?
Thank you, Chair. I don't have any input, but we do welcome the presentation.
Thank you very much, honorable members. Ke nako ya matsoho ba ba nyakang go commenta mo gore setšhaba se be le input e ntšhi then re kgone go kokoantsha dintlha go na le ba ba nyakang go bolela se sengwenyana ka mo ke tlo lefa di-number ne number ya gago o se ka e lebala number 1 number 2 number 3 number 4 number 5 Mama, 5, yes. 6 and 7. 8, yes. Ke 8 ya ker. Kamo 9 ko morago. Yes. Emelelang ge ka ba o emisitse letsogo a ka o bala. Ke 9 ka mo akere ya a go sana le leng le ke sa le bala ke sa le countang ka mo ke 9 ke tla ka mo number 1 yes 2 ke 2 3 a go sana le lengwe akere ke 3 ka mo okay. Thome ka number 1, my dear sister there.
Dumelang.
Ahe.
Lebitso la ka ke Thembi Thwala. Question ya ka ke hore as department le setse le boletse hore le bone hore hona le matsapa in connection le ho apply la di funding. So I don't know hore maybe department e ka gona ho thusa hore batho ba rena ba bontsi a ba itse ho etsa di business plan. So maybe ho be le ka mokgwa ba ka re thusang ka teng ho be le di workshop or anything e ka thusang setšhaba hore ba itse hore he ba applya bjang he ba engwala bjang then that would be much better and then I think e ka thusa community thata. Ke a leboha.
Thank you. Number 2.
Dumelang. Ka lebitso ke Johanna Mokgwaso. Ke tlhakele ko region 1 Soshanguve wa 25. Ke utlwile mo le bolela ka issue ya GEP. Nna ke one of the beneficiaries tsa GEP. Yes, GEP e re fa di skills. But the problem ke hore a re kgone fundiwa. Like nka le botsa ka ya last time e re kry-ileng last year. Ne ba ruta ka agro processing. Ba rutile ho etsa peanut butter. Mind you, we ra peanut butter o nyaka o rekisa hore bana ba khone ho ja ba o fa motšhino mo monnyane bjana. Ke nna go mokhukhung ke botsa batho re ke rekisa peanut butter ha ona go ke berekelang ko teng. So hora hore maybe ke tlhoka zozonyana e o right-nyana le motšhino o moholonyana and then ke khone ho tswela pele ka di skills se ba re fileng tsona. Tsona ke tse ntšhi nna ke di kry-ile tse ntšhi mara problem ke taba ya funding le metšhine ba re fang yona ke menyane ke ya ka mo hae o ka se khone go roka tikerela business gore bana ba khone ho ja. So no ke re department le yona e re khopela gore le botseng batho ba GEPF ke GEP ne sorry GEP ba strengthen taba ya bona ya di fundings. Ke a leboga.
Number 3.
Dumelang, Chairperson, rona re ne le di company tse di complyang. Ha le di comply, a ke tsere ke mengwaga me kae. Mara jopo totolo. Di nyakele jopo for rena. Re nyakela bana ba rena. Na le a bona ka matlho re. O ka re matšatši a feta. So, a re nyakele rona hore nna ko bereka. Ke nyaka se ke se itseng ke se rute bana ba rona. Department always e ba re botsa dilo ba re botsa ka gore re Gauteng e ba re botsa dilo ba re botsa ka gore re Gauteng re ne le Tshwane Tshwane mo gaufi. Why department e sa tle mo dilo tsa yona tlo di irela mo Tshwane. Rena ba mo Tshwane re kgona ka bo gaufi. A rena tšhelete ya o namela mo re ya Gauteng, re o maketa Gauteng, re boe re le empty, re boe hape ba re bitse beke e tlang, re boele Gauteng. Ne re kgopela gore department ga e bule di office tsa yona mo re kgone go berekana le yona re le mo gaufi mo. Because di company tse re neng le tsona dilo tse le di bolelang tsa GEP tse tsotlhe re ne le tsona re a comply ga ona ntho e re e tlhokang. Ntho e re seneng yona ke ona mmereko fela gore re fitlhela yang ko ona. Ke a leboga.
Number
Wela,
4.
lebitso ke Lesiba France Charlie, Ward 38 Mamelodi. Ge le mantswe a mantši ba tšere, but se se nang le bothata ke se se tee. Mo Mamelodi there are traditional healers ba e leng gore ge le bolela ka health, they are part and parcel of that status. And in that regard, ga le kgone go tla le ba etela, and in some instances, ge le fane ka di-address tša lena, and le kgona go romela o mongwe ko go bona, then I think ka mokgwa re tla be re promote the welfare and the health of the society. Amen.
Number 5.
Sanibonani, ngusara Jiana, umama Mahlangu eRithabiseng okhulumako njengamanje. Bengicela ukuthi njengoba ubaba saqeda ukutsho ukuthi sicela usizo kuma traditional healers ukuthi le mithi eminye eyembiwako kuneminye imithi ephelako, then sithole nokuthi basinikeza i-office indawo lapha, then tholakala ukuthi anikwazi ukuthi ningakhanyana ni surround nakhe ukuthi kuvaleke lapho kubonakala ukuthi kunabantu aba owner la nanifikako nibeka something nithola ukuthi seyathethiwa amasenke la sizisebenza nje sibe amasenke la uselathathiwe mara ene siwahlanganise ukuthenga isenke nga-1 njalo nomnye wezana elinye nawubuyako akusenalitho njalo nje sesiqala phasi besicela kheni sicabangele bese niyasifanda. Ngiyabonga. Bese ke abantu abatsha le eRithabiseni sicela ukusizwa ukuthi abantu abatsha babe nomdlandla wokusebenza bafuya ingulube lesasikhathisele kunokugula kwengulube zafa zonke kanti besele basebenzile kancane. Umama uThokodidisa uminister akhe wabazama wathi uyabasiza ukuthi bakhone ukustarta, then ingulube zake njengokugula besele kufikile amahogo lawa selawile konke nje bastakile abasazi ukuthi bangasizakala njani, kodwa icertificate ze-agriculture banazo bazamile ukuthi bahlanganise bathole icertificate ze-agriculture ukuze bazenzele amabhizinisi njengobanyana abanabo grade 12 bangakhona ukuqhubekela kwamanye ama-institution. Then sicela usizo nalapho emaplazini ke bakwethu, emaplazini sicela usizo, amaboda awile sicela nalapho kheni sifandeni bakithi ngoba nakhona sifuna ukutshala, sifuna ukuyokufuya ngoba nje lapha elokishini lapha ifuyo leya isendaweni encane ilikuthi sinendawo esikhulelekiyo esihlezi lapho amathuna wabomkhulu nabathuna wabo baba nabomma, then bachile kuwile, then siyaxakeka nje sewuphethe uyabutha ngamalanga awukhona ukuthi ubone ukuthi wenzeni ngoba kudingakala imali yokuthi ufake amanzi ufake ukhona ukwakha ngoba amaboda abo baba bethu bebakhe ngehlabathi namanzi. So sicela ukuthi bese i-agriculture ke isize bese iyabanikeza something okunjengemadlana ngoba bayakhuluma khona ukuthi sizonisiza ngemali engaka mara nabafika lapho baqede lapho nabangakakutholi bakuchiye kanjalo usala ukhamsile ungasazi na ukuthi wenze njani kodwa ufuna ukusebenza then bakuchiyele futhi baqhubekele phambili then wena usoloku umangele awusazi ukuthi wenze njani sicela usizo lemaplazini amaboda awile sifuna ukwakha sifuye siqhubekele phambili ngokufuya please bantu benkosi sizeni special abantu abatsha bakithi ngoba nasinje niyabona nana iminyaka iyakhamba sifuna ukuchiya sazi ukuthi leya ilegacy bona nje ngendawo engikhuluma ngayo abadala bethu bachadele lapho sizalelwe lapho sesi over 60 kodwa lezo ndawo lezo sekhona siraro imali yokuthi sisizakale nawusithele uthi uyabafonela abakwa agriculture usabatholi abakusekho kuphendulako sewusele umangele sewusele uthi khani ngeofisini khani ngiyenzeni bazokujika jikisa abadlale ngayo ngoba nyana ungugogo but ufuna ilegacy yabantwana ngoba from 1952 bantu benkosi nicabange umuntu uhleze endaweni from 1952 until today then bantu benkosi inzima leyo nto leyo sicela usizo le-funding leyo sizakale ingakhulunywa kuphela kodwa labantu bangema-ofisini abamasukujika ngetulo badlale ngathi ngemfoni because of ubuyele ekhaya ihliziyo ibuhlungu siyanicela sicela nis-attende njengoba nyana nis-attenda nje but nikhulume nabantu benu bangema-ofisini ababadlala ngathi njengoba sibogogo please sicela usizo badlala ngathi bantu benkosi I'm talking out of experience.
Okay, re a leboha le ska lebala hore rena re tlile le Department of Health ya Gauteng mabapi le hore township entrepreneurs aba benefit tabeng ya distribution ya ditlhare le go distributor metšhini in health facilities. Impa tsa agriculture, we also hear you and then we will also communicate le chairperson and members of agriculture who raise what Mam Sarah has raised. So let's go lebala hore rena mo rena re tlisitse department gore e le thuse already ba rile go tla ba le di road show ke re gane le tla ba botsisa gore re emelene road show so that re tle re thome go understand gore ya department ela e tla gore le rena re tle re lokele letsogo ka o distributor ditlhare le metšhini le ska lebala ke re ke a re gopotsa gore re ska lebala ke re re a leboga di inputs tse di tlileng di important some rena re province go na le national ya bomme Thoko Didiza ba department ya agriculture re tla leka gore re ka thusa bjang gore bomme Sara ba kgone go bolela le bona ka di issues tse mme Sara di raisitseng a re di latlhele ko ntle a re yeng ko number 6
dumelang ka lebitso ke Tumisang Nkosi from Ward 33 Soshanguve. My first question has to do with Propeller. How does one get in touch with Propeller? Rekragai Propeller. Right, Google, how can one get in touch with Propeller? My second one would be a suggestion in terms of delivering equipment and medicines. How about, there's an economy right now is doing very well, eco-commerce. That one has to do with deliveries and whatsoever. Where I come from, there's a company called Rara Academy. It deals with teaching young people how to drive scooters and whatsoever. I was thinking maybe if a Department of Health could maybe tap into that industry, eco-commerce. And then the other one, I would like to thank you very much for not taking up the decision by the courts. As young people, as black young people, we need such people like you, sir, who would really stand for us and say, no, young people need to benefit from us and black people need to benefit from us. Thank you.
Thank you. Urile kwena ma'am? Thank you. Thank you, Dumisang. Number 7.
Dumela. Nna ka lebitso ke Francina Dikole, ke tlhaso Shanguve ko wa 33. And the question ya mathomo ke na leng yona ke gore what types or kind of companies must apply to tender with Department of Health? Okay. And then number 2 ke hore after applying after the company's name, what are the requirements for that company? Hore ba kgone ba into the Department of Health tendering. Thank you.
Thank you. Number 8. Number 8.
Thank you, Chair.
Okay. I greet you all in the name of Jesus. My name is Pumzile Caesar from Soshanguve, Ward 33. Ke a itse hore today, what we have today, ke hore, re fiwa the feedback concerning go thusa di township. But ke batla go tswa ganyane because of ke feel hore we are here with the Department of Health, and then some other times we miss dilo tse ntši if re ba stereotype. I will say that because of ka nako e nngwe o kra re lebeletse se re se tletseng kante re ka extenda dipotso tsa rena hore re kgone ho kra thuso. For dilo tsa o supplier medicine, ke rata ho leboha thata hore le fa community opportunity ya hore e khone go bereka le yona. The other things ke hore if ke feel hore now if you say health and welfare and wellness ke ba le concern thata because of wellness ke go phela ha batho. Ka siZulu re re ukuphila kahle umuntu. Then ke ba le concern especially in our ward re feela ke Department of Health from ko di clinic tse lo reng di a re service rena re le ward 33. We had an incident 3 days ago mo lo reng go na le mme wa esetse a godile a tlhokofalla ka mo ntlung a tlhokofala a bola ke diboko. And then ke chronic patient eloring is serviceiwa around the around clinic ya rena ke re nna department inna biang isa bone patient ya yona matsatsi a mantši since from last year 2022 ka October until 2023 ka March abe a tlhokofale ba itse hore bana le patient ka mo modifying tsa bona eloring ke chronic eloring now and then watla atlo phaka medication watla atle for check up. Why a department is a created the food soldiers eloring di tlo tsamaya di check up balwetsi ba bona especially ba loring setse ba tsofetse e tsamaye yo check up balwetsi ba bona ko mahae ba loring ba bona hore ntwengwe eloring ya disturb thata go hore department e khona ho funda di stakeholders tse dingwe hore di tsamaye di o checka di tsamaye di latelle batho ba ba leng HIV and positive ko mahae ba ba loreng a batle ba tlo phaka medication ya bona. So why the department e sa berekisi that system e ya hore e latelle everyone e loreng wa pallwa especially chronic people because of ba ya khafetsa go di clinic ba lata medication wa bona. I'm very disappointed go ba ka mo go ba ko situation sene ke leng ko sona 2 days ago because of what happened the time we phoned the ba di-ambulance ba tsere nako hape ho fitlha ko releng. He ba fitlha ko releng kwale ba fitlhile ba palla le ko bereka because of they were vomiting. It was a disturbing situation se loreng ke feel hore the department ya re faila. Re tsamaile ra ya ko clinic re ilo nyaka di surgical glove le di mask. We were told hore ke tsa balwetsi. Ke the manager ya the clinic hore those things ke tsa balwetsi. So I'm very much disappointed.
Akere batho he ba phela ko community ba phela le di neighbor ba phela le di family ene ke nahana hore di department e kana ya se kgone ho ba everywhere in each and every household. So ho botlhokwa hore ge re phela ko community di neighbor di kgona go checka hore ka mola se ke ba bone ba kae and then ko re ke go re phele le batho ene ka nako e nngwe sister ge re ka tla ra fa dilo tsa ko tleliniking to everybody go tlo šala go hlolo go sana stock because a ke re go na le gore a ba sure ka taba eo ene mandate wa bona ebile o ka ra o ba dumele le gore ba ye ko go nang le situation problem ke ya ambulance if it takes time gore e fitlhe ke bonang gore eo e ka ba bošaedi mara ya gore sister o le timile ke nagana gore mohlomong go be go ka ba le ka tsela e nngwe e ba ka beng ba berekile ka yona mara batho ba bangwe re phela le batho ba bantšhi ba go tswa tseleng phumzile ba ba sa direng dilo ka tsela e right. That is why sister a le careful gore a ka se fe anybody wa tlang ko tleliniking because go na le batho ba bantšhi ba botlokotsebe ba tshwarang ditleliniki dipoo ba fitlha ba utswa ka mola so go ngwe go re tla re department e bone gore how can they improve when a member of community who does not come every day to ask for that mara ka nako eo go be go na le emergency ba ka thusa bjang go ya ko pele so that ba ska deny member o a leng G9 go tla go reporta something like that because maybe le file gona ko tleliniking and then ge ba sa bone motho o atla go ka be go berekegile bjang gore ba thuse phumzile ka seemo seo re department e tla respond. I'm not responding on their behalf, I'm just saying ka nako e nngwe go boima ka gobane re phela le botsotsi bo bontšhi le motho wa nnete ga a tlile a o sa le sure gore o bolela nnete ke seemo se re kry-ang re le go sona as a country. Number 9. Ao, setse go na le 9 times 2 ka a ke re ke kry-ile 9 mara go lokile re tla fa o a beng a se a emise letsogo ka gore na re ne re na le matsogo a 9 ka a ke re ke rile o mongwe le mongwe a keepe number ya gage number 9.
Hello, dumelang ma'am.
Age
Ya, nna ke Nkululeko ne. Yeah, I represent into the military veterans mo Gauteng. I'm very much happy about into a presentation in Ndima concerning batho ba abaziphinda-phindayo mhlambe ku-service delivery, particularly kuyona le yokudistributor ilokhuzana amapilisi la ema-clinic. But now the problem is one, if we talk about a military veteran, you're talking about somebody who's very much poor, doesn't have anything. Even if we can get maybe that tender which you can distribute medication in a clinic location, the problem will be one, the transport to the because veterans don't have anything. No more to have a bank of funny loan. First thing was the funny short return, we don't have anything one. So my suggestion in this whole thing was that, my submission in this house is that How if maybe we can relax ilokuzana lecho ubabu ndima ukuthi a person is not supposed to ukuthi anga lokuzana anga deal in the government several times I won. Ukuthi those who have been in the forefront before previously, if maybe was maybe somebody from a disadvantaged group like I'm a veterans per se, those ones must be given a chance to mentor and to assist our veterans in terms of ilokuzan, transport. Maybe even maybe that tender can be split into two, which is a certain percentage. If we are providing a transport, then our veterans will get a certain percentage. Because if our veterans can simply go straight, I think no one I told that tender will be effective, no deliver in the first place. So my humble request to this house is that if maybe somebody, if maybe we can have an incubation process of some sort, if veteran, I'm a veterans and a company, the corner the government, they must be given a chance to be incubated by mentoring our veterans. That's my humble request. Thank you.
Thank you. Number 9B.
Sanmonani. November ngokamdluli ngisuka ku Step4 Group Pty Ltd. Ngiyajabula futhi ngiyabonga ukuthi government ikwazile namhlanje futhi ukuphinda ibuye kithi njengomphakathi isinikeze le opportunity lena lekuthi izinto abahlala bazenza njalo for 30 years siloku sihamba ama presentation ekugcineni siphuma selengisizandla kodwa this time ngiyakholwa ukuthi kuyoba khona ushintsho. Ngani ngobe ma RFQs nama tender nayo yonke into government most of the time isebenzisa isystem labayibiza ukuthi point system. Le point system tina is rejected automatically because we don't have experience number 1 which is minus 10 points. The other point futhi lephinde siyiluze futhi ukuthi izimali zethu akusizo imali zokuthi mhlambe nginama assets. Mara maungathi uyabheka emalokishini imali ikhona because most of the time uma unotice siyakwazi bayakwazi nokuthi uma sithola imali yama investment or mhlambe ngiphume emsebenzini into option lenginayo ukuthenga ama taxi noma ngivula isporto and lezo zinto lezo yizo izinto ezibonisayo thina ukuthi emalokishini imali sinayo kodwa manje le mali lena ayigarantwa yiyo igovernment mayingaba nesystem lapho khona bakwazi ukuthi recognize nemali yethu esinayo bakwazi ukuyi recognize because le mali yethu most of the time is not bankable because I reflect in a bank statement. So lento lezo ngizo lesi senza ukuthi singabi nama opportunities. If bangakwazi ukuchange le system this time ngoba bakhuluma ngayo ingakwazi ukusisiza. And then ngiphinde ngifuthi ngibuye ku point ye Gauteng Enterprise Propeller. Ngakhuluma ngaleli lapha eJimston. Ngaya khona ngafika ngabanikeza iCV yami. But after ngifake ama proposal nama business plan wonke after 6 months ngayibona the very same proposal ne business plan yami iphethwe omunye umuntu athi uyithengile loyo business plan yami. Uyabona so lento lezo siyas discourage kakhulu because baletha abantu ukuthi beze labantu bafe bathathe lo lwazi lapha kithi from there bahambe babe worth ngathi and then thina sihlale sinama business are useless most of the time. That's why abobaba lapha basho athi mina ngine business nami nginayo from 2008 till today sitting run ama business but akangisi indawo ngenxa yokuthi ngiyaye ngirejectwe ukuthi experience anginayo. Number 1 ngilose ama point for logo nokuthi futhi anginayo ibankable uyabona mara ngibatshele ukuthi if ngiyanikeza le tender le ngingakwazi ukuyenza. So lezo zinto mazinga change maybe singaba nama opportunities. Ngiyabonga.
Thank you. Number 9C.
Oh.
Akere kune ba bang ba enamela staff ka.
Ngiyabonga che. Mina igama lami uSibusiso Madonsela from Ward 25 eMfuleni Sidibeng. Bengifuna ukubuza ngendaba yekhwela. If usupplier ekhwela yafuneka na ukuthi ibhadala uyeregister ke na. Enye point bengifuna ukubuza ukuthi uma if department iceda kuku appointa uqala nje njengomuntu webusiness ana izokhona ukuthi yokutshengise yokusupply njenge loan na. Ngiyabonga.
Thank you, Sibusiso. 9D. Akere leng hijackile kam. 9D. Hona kam. Ah, okay. Kwa di lasi ne kam.
Sanibonani nonke. Nikhuluma okhulumayo uSarap wase eRetype ngeWard 103. Mina ngizokhulumela mayelana ihealth from eclinic yaseRetype. We know senza inkinga sashisa iclinic kwathiwa amakoseke basakhele bathi no sishise iclinic bazaphinde babuyi. So abantu abogogo bethu eRetype bahlala ngaphandle abafani nabanye amakliniki besicela isicelo ukuthi nisize ngeclinic yethu ukuthi at least nidonse mina ngi-CSW khona le eRetype mara ngisebenzela ngaphandle if imvula iyana ngime ngaphandle we understand if kuyashisa ilanga ngime ngaphandle esihlahleni because of asinandawo indawo yethu iclinic yethu yaseRetype le holo leli likhulu kakhulu maybe ngingangena ka-100 iclinic yethu we know ukuthi nazi ukuthi iclinic yethu ema-ofisini ukuthi iclinic yaseRetype incane kakhulu ngicela nizosidonsela leya dining room ibe iclinic ingasaba i-dining room sesikhathele and sicela ukuthi imithi nisilethele yona ngendlela e-right because abantu bona bacabanga ukuthi thina eclinic asifuni ukusebenza kanti siyafuna ukusebenza nethi amanye ama-material i-government yethu iyasifeyila isilethela wona late siyacela ukuthi siletheleni because ngoba mabajika abantu bathi no abo-sister bafuna ukusebenza akanti abo-sister bayasebenza nethi problem okunye asinayo eminye imithi thola ukuthi bayayi-order mara ayifiki ngaleso sikhathi like namathishu asibi nawo like namanzi ayasihlupha eclinic yethu siyacela even nalento abasifakele yona makuhamba igezi uthola ukuthi abalethanga abasidiliveli kahle idizili kugcine kubola ama-injection wabantwana mabasebenza abantwana bazohlaba bathola ama-injection akasekho ngoba amoshakele because of i-low shading isimoshela amalontuza ama-injection please sicela nisi-assisteni because ngoba abantu bacabanga ukuthi thina asisebenzi please sicela nisi-extendeleni neclinic siyanicela kakhulu because ngoba abogogo bethu bahlala ngaphandle abakhona ukuhlala endaweni e-right please sicela nizosiza ngeclinic yaseRetype.
Tanki Felice kamo number 1 kam. Mr. Piti is here utla thusa ka ho araba the issues tse di raisitseng ke Sarah. Yeah, number 1.
Ngizothanda ukubulisa kwi-department nakuwo wonke umuntu ola endlini okhulumayo la uNomadlozi wakamfukeng oyi-ward committee serving under economic development. Ngizothanda ukukhomenda la kuyindaba ye-CSD. I-CSD mawuregister la kwi-database yona iyasebenza kakhulu and then bayawathumelela ama-tender nemisebenzi but engizokuthanda ukucela ukuthi batshintshe the way bavula ngakhona ama-vacancies because ngaso sonke isikhathi uthola ukuthi bathi supplier and uthola ukuthi ibhizinisi yakho iseseyintsha le mali bathi hamba othenga lezo zinto lezo uquote usupply awunayo so mongakasebenzi kuba nzima ukuthi ucomply so siyacela la ku-CSD ukuthi ngathi bangamixa imisebenzi le abasuke bayikhiphile kwesinye isikhathi mhlambe bake bakubize uzosebenza ngaphandle kokuthi kumele uyothenga imaterial ubuye usebenze bayimixe kungabi into eyi-one ukuthi each and every time kuzomele wena usupply of which asikasebenzi imali yokuthenga izinto lezo azikho. And then number 2 ngizongena kwi-issue of land. Siyacela ukuthi nisisize nange issue of land. Abantu bamabhizinisi there's no site indawo land for abantu bamabhizinisi yokusebenzela. Uthola ukuthi ba end up abahleli nama companies wabo akunalabo asebenzela khona because land occupied akunalabo kusetshenzelwa khona. Kanti at least ungaba busy ngokusebenza meanwhile usamakhetha umsebenzi for i-profile yakho. And then okugcina ngisizocela ukuthi nama department ake eze emalokishini eze emawodini because iziningi izinto esizidingayo. Izinto ezinjengama skills. Amabhizinisi sinawo but uthola ukuthi uma uthola umsebenzi skills azinazo. Example like maybe uthola itender kwi construction bathi woza uzopenda. Uyahamba uyalapha you don't even know anything about painting or ukufaka ama caps or anything. Awunaso leso skills leso. But uthi rana ibhizinisi. So siyacela kuma department ukuthi mabangaphelele ema officeini beze emawodini le information siyayidinga abantu bayayidinga information ngiyabonga.
Thank you. Ward councillor akathusa especially more the issue of the land more for businesses. Number 2.
Yeah, Tovela, I cannot task it over 38 Koma Melody. I check this presentation. One more 18 billion things for what Navaka Sanjava, the country Hamibereko. So, can I issue mission come horse and is the only to such. That then, Dima. Kana hanar medicine le machine for gore batho ba rena tla ba bona ba shumisang dilo tsa mohuto a go kgonagale bonolo so ke be ke re mphe di opportunities tse dintse le di identify-ilego for low skilled entrepreneurs in the townships. Also ke suggesta gore department ya health e shumisane le Department of Environment for go cleaner the township tsa rena di ditshila Thomas ka tswana ba re di maswe a go laetse health go a go health e botse mo di township ngo lebeletse. Finally ke leboga gore ge le ka tswela pele la tlaria road show e mo di region tse di swanetseng tse 7 in fact in Tshwane re ka le engage further.
Thank you. Number 3.
Ke dumedisha ba department le chairperson le ka batho ka moka. Ke re go gopela re presentation ya department ba iriang se ka no ba presentation e se gale batho ba timella. Nke ba re thusha ka RFQ tse. Na ke bolella ga ton la baso. Re gateletse man re ka ra wa palma re gopela RFQ tse ile ngone tse 400 tse unge ba re thushe ba re fe tsona. Re khono yemela ka re mo di wateng ja rena le gona re ra zama mo gona re a lelekishiwa. Corner to corner our khono kra kepen. Okay ke a lebo.
Libitso
Ke na rontsha manala from Ward 38 Mamelodi.
ra leboga ka mo a gone 3A le B le C. So a ke re kreile matso a 3 fela ka mo. We are done. Okay, brainwave ke re Telefa 1 minute each. On est 3A et 3B. If comme raho 3A, 3B, les cas le valeur le Department of Health, roulez the entrepreneurs that are not benefiting. Saying the carabo or the comment is for noting. Mara roulez health. and entrepreneurs from the township. 1 minute.
Okay, thank you, Chairperson. My name is Busiso Kumalo from Ward 17. A presentation is really, Chairperson, that was presented before us. But my consent is one. Ngizobe khuluma nge Gauteng propeller. At least if you were talking about a Gauteng propeller, they are here. Now they are not here. Asazi ukuthi lento enisitshela yona, is it true or not? Because they are not here, and then we heard other speakers be complaining nge Gauteng propeller. So now, kuma road shows, you must make sure ukuthi I Gauteng propeller iba khona. And that Gauteng propeller kwamele ukuthi ibe ne SMME hub, because right now when we are speaking about ukuthi people, they must supply medicine to the government whereby they are not trained. It's like sidlalisa icarrot nje ebantwini. Laba bantu laba, they won't qualify on that up until those people I-Gauteng propeller ngoba umsebenzi wabo. They must make sure to mentor lama small businesses, because uma ngabe uqala i-business futhi ngicela ukusukuma Chair so that uzongibona yabona. Chair, uma ngabe uqala i-business ku government kunama red tape akhona ne, and then those red tape kuba difficult ukuthi ukhone ukwandlula whereby awukakaze wenza i-business no government. Now into esicelayo ukuthi i-Gauteng propeller kwamele ukuthi benze i-MMC hub, so that laba bantu laba bazotrainwa then bakwazi ukuthi bangene ku system. Other than that, ayikho into esiyenzayo. Then about disability people, yes, siyathanda ukukhuluma ngabantu aba-disabled senze ngazuthi like we care for them, while we know ukuthi we don't care for those people, because even if you can check, even in the government, abantu aba-disabled abasebenza ku government, ama percentage they doesn't balance. So we must do something ngalo zinto lezo. Then lastly, ngibuya e-Western area, ama clinic wethu ama Mini Cooper. If you know Mini Cooper, the population yase South Africa is growing each and every day. Angazi khona lento kuthiwa ngama smart clinic ekhakeni isipheni ama smart clinic man. At least so that nathi sizothola a better service, because right now kuma Mini Cooper omunye akhohlela ngapha omunye unantontoni in the same room, but you are speaking about health. Why is thetha ngento esingayenzi? Because we must kwamele ukuthi sithethe ngento esiyenzayo. Ngiyabonga Chair. Thank you.
The last 3B.
Greetings, Adrian of the Most High Jah Rastafari. Lono kolomaka ulitlokhona lo opet wakwakhumalo. Ngibonge mntu. Ngizoxagela kakhulu kubaba umdluli ngale. Mina nobaba umdluli ngale siyafana. I'm 30 years this year, I'm turning 31. GEP, every time angifika lapho, ingathi ukudlala iketo. You get there, this one will say go there. When you get there, this one will say go there. When you get there, this one will say hambe endaweni so yofuna into ethile. It is not a propeller. Those people are running their own private businesses kulama offices wenu GEP, and I can give you addresses if you feel like it. But then angifuni ukubafaka enkingeni, because then I'll be revealing a whole lot of things. I'm 30 years old and I've been in the field of plumbing for almost 10 years. I've been trying to resurrect that very business, plumbing and fitting. Till to date, when I step in front of the doors, the GEP, kune red tape. Yes, I admit, but I'm theoretically maybe half stupid, but practically I'm a genius. So you find people like me out there in the streets who has the energy and the capabilities of getting the work done. But you people choose the book smart people who know nothing about field work over us. So with that being said, in terms of how the medication will get to abantu ema location in, before you even think of delivering that medication to the locations, have you seen the well-being of those locations? Before you bring in health, because I mean cleanliness is next to godliness. In Dokala, clean out those streets where you taking the very same medication to. Akusizi nisilethele imithi endaweni engcolile. Akusizi ukusilethele imithi endaweni engange one room kama wami la ngikhulele khona. Su 18 ngaphakathi singamanesi sodwa mase kungena ama patient kuba njani? Bengicela nje ukuthi njengoba nihleli napho 2 4 6 7 ngicela nithatheni umsebenzi wenu serious or kunabanye ngithi abasemva kwenu enibathumayo ngeza ukuthi hey gijima uyele ostolo gijima abafana nami. So ngicela nitshele nabostolo gijima benu ukuthi they must hit the grounds. They must get off from those chairs there in front for once and come and join these people here and feel what they feel. Just for once. Go and visit that clinic that you visit for 2 hours. Go and visit it 3 days consecutively. Because whenever you people go there, these people bayalfihla uhlazo. Bayalfihla uhlazo. Mase nihambile iyasiqala inkathazo. So who's fooling who? Because we know very well that you might be fooling them as much as they are fooling us. So with that being said, ngiyanicela all 7 of you up there, oh mama emuva ngukuboni 8. So please, ngicela singabe lama meeting lawa almost every 3 months, 2 months, every week legislation yahlala. But the locations are not changing. Mangithi locations ngikhuluma eKasi straight elokishi. Nothing is changing. Ngiyabonga phe kwalo.
Thank you. Without any waste of time, I'm going to hand over to Mr. Ndima for responses, and just be aware that some of the comments we selected this topic to bring it here and get your inputs. So other things we will send to the relevant department. Mr. Ndima.
Thank you, Chair. I think I'll try to go one by one in terms of questions, but where questions are common, like I'm picking up a big issue about funding, maybe you'll have one response. So if I respond on one item that has been asked by 4 or 3 people, I think that should satisfy everyone. I think I'll start with number 1. I think taking from my presentation, I am now picking up something that GEP has its own requirements. And from the experiences that I get from the first question is that there is a need for business plan workshop, right? And I think some of the people that questions, they talk about incubation and all of those things. So it's something, although you ask it differently, but it's one common area whereby there is a need for a workshop. And it goes back to what we have got from GEP, that most of the business plan are not viable or are not talking to their requirements. And you just affirm it yourselves here. And as a solution, I think, Chair, on my personal space, I will speak to the CEO around a workshop on their requirements, but I think the committee as well can do the same. I think it talks also to number 2 with issues of non-funding from GEP. If your proposal, there is no form of security that the business will work, I doubt even anyone can do that. It's like your kid. If a child is asking for you 20 rand and you cannot determine as to what will this child do with this 20 rand, and perhaps you are worried maybe he might buy nyaupe or whatever. So there are those risks in any funding institution that when they give you money, are we giving you money to actually do what you're asking us to do? But if your proposal and your business setup doesn't talk like that, those leads to rejections. And it's something, again, that I think it should form part of the GEP workshop requirements, because it talks to what is it that they want from small businesses. I think also there was a question on number 3 about not complying to tenderings, and they want jobs. Maybe if, I think it came also to number 90. I mean, maybe we should do these things to create less dependence on our problem. One must identify and establish what kind of business do I want? Do I want to work or do I want business? Those who are SMMEs, they will tell you it's not easy, because prior even to get something, there is a lot of rejections that are taking place. So, for example, it's going to be very difficult for government to say, I must get a job and make more, a certain money, then I go and start a business. It's not practical. It's not. So what we need to do is to deal with red tapes that the gentleman that has spoken about, to say, in this process that we have of the CSD, what are the red tapes? And I've presented on what we're doing, especially in the new financial year and on our department, that one, we want to respond to communities. We must have list of database of all our regions, so that when we invite people for imisebenzi, we know that we have invited people in Tshwane. You don't get a surprise here when you are here, you see somebody from Sebokeng and is working here. Was your name Spusiso from Sebokeng? Yeah, but I'm just saying that those are the things that we do as a department to ensure that we are responding to the needs of that particular community. But companies, unfortunately, it is the law that you have to comply. It's going to be very difficult for a department to give you a job. One, you don't have a tax certificate. Remember, the same money, that money that goes to tax is a trust fund money that comes back and do service delivery related matters. So if you're not compliant, you're taking money to yourself and you don't plow back as well to government to assist on services. It's a problem. For example, if you are in building like Miriam was talking, you don't have an HBRC certificate. There are so many things that you must understand about building. For example, safety measures that you must go through when you are working on a site. What is it that you need to do? We all have seen in many incidents, even on TV, whereby children fell on pit holes. Is it pit hole in English? Yes. So you really need to be a company that is compliant, that is an understanding if we're working to our communities and you're digging holes. So compliance, unfortunately, community, there as a department, we cannot even guarantee to move away from the compliance, because there are regulations, there's so many things that brought the compliance in all of these sectors. So there was a question, I think the question that Uma asked on number 5 was around farming. And I think that we should just take it, as the chair said, to that particular or relevant department. But also, I think you can speak to Mr. Pizzi about traditional healer program. There's a program that the MEC has established where she's passionate that traditional healers have been neglected for so long and they help us a lot in our communities, but there's really no recognition on them. We're talking about traditional healers here, not the other way, those who are healing people. I hope I make sense. Now, all other questions are talking again to GEP funding, and I still maintain that we need that workshop so that people can understand and how can they get a loan, what kind of requirements, or what is it that they need to meet. And there was a question about type of companies and health. Health is a different space, and there are certain requirements or compliance that one must have. For example, I think there was a gentleman that was talking about distribution of medication and all of that. If you're gonna go into that space, you need to acquire a certificate or compliance certificate, like a tax certificate from SAPRA, that will actually assure us that you are able or you are capable to handle medication. Our medication are in schedules. You'll see Schedule 5 for chronic illness and so forth. Even the temperature that they are guarded when they are transported, they need to be at a certain temperature. So, and unfortunately, it is the medical requirement. It's not of NDIMA or the chairperson or the department, because it is known that as Umedemi community health worker, if certain injections are not stored in a certain level or transported in a certain way, they can be damaged and they become hazardous when they are used to people. Now, then there was also some questions, and I must, on behalf of the department, ma'am, I think you were number 8. We will apologize that you have lost a loved one, and there are certain things that you feel that the department has failed you. Condolences, and we as the department, or on behalf of the department, we put an apology. But there are certain things that we're gonna do as the department. One, any ambulance that is called, once the call is connected to the EMS, that call is recorded as to what time was that ambulance called and how long did it take to get to the place. One of the things that the community must help us, if I were to divert a little chair, our ambulances are tagged. People are calling ambulance and when the ambulance arrive, they rob them cell phones, they rape female EMS people. And you must understand now, what effect does that make? Because it means that although you're calling an ambulance, there's a fear, and those people must assure that really the call is genuine. So as the community, we must guard against those things. And that takes me to another area that was asked about, the space of a clinic. We must guard against government properties. It's a fact, colleagues. There is no new money. If this library has been built here, there's no money that is going to come elsewhere to fix this library if certain individuals decide to ban it. It's a reality now. Previously, government used to have additional funding. As the gentleman correctly saying, the population is what? Expanding. So it means the kitty or the money that the government have, it becomes lesser and lesser. So if you have somebody in your community that decides and ban a clinic, we must all be aware that we will have problems. So when we march for service delivery services, we must also guard against those ones that are breaking even the robots, because it's bad. Now kids can't cross the roads, but if you think about it, they were all the men and women who were busy breaking robots. Let's all take responsibility, because this government is your government. Maybe it's understandable during 1976, during apartheid, that there was a need of change of the regime. But this is your government. So please, let's take care of government properties. Because if you ban it, you will not have any other one. So again, Mesara is a community health worker. It's also something, Mr. Pitti, that one needs to look into, since Tswane is yours, as to why the community health workers were not able to identify your case. She is here, she was talking about the injections because of the diesel, that sometimes they are not there. I think maybe, Mesara, please share your numbers with the community, because community health workers are employed or appointed to respond to immediate issues in wards. That is why they are ward-based. in terms of medication and people that are in those areas. So I'm glad that Sarah, you're here. Then, again, it goes back, Mr. Nkululeko, he spoke about military veteran and the issue of affordabilities whereby you need resources. Unfortunately, and I think we must do this, let's choose our businesses. Let's not choose a tender that will require you to buy 5 trucks. We start here, we go up. It's a reality community. So for example, if you know you cannot afford to have 5 trucks that will distribute medication from Joburg to here, it's quite difficult for one to actually go there. You are setting yourself a failure. Because even when you win that tender, you will not have resources. You must go now higher and you'll end up making no money and you'll fail in your job that you're supposed to do. So I think let's find a way of saying, this is what I want to do, but is it something that I can do? So let's do that introspective. And also, there's an issue that was raised about the point system. One of the systems that we've put as the department, that is why Peter now, we're putting him there. There's something that calls locality. So for example, it's part of the point system. If the company that we're inviting, the one that one must do a job here, is from Tshwane, that company will have more points than the company from Katlehong or from Westland. So it works in both ways. So unfortunately, for one to decide in terms of competitive bidding, there must be a point system. It's how the Procurement Act has been created. And unfortunately, it's something that we need to do. And I think other questions about GEP, they are the same. Same question, 9B, same question, and which is I've answered earlier. And also, the same question by 9C, Sbusiso Matonsela, it's the same question. We need to also take time, go to GEP offices, ask them, what is it that you require for me to get a loan? How must I respond to? Because we'll make a commitment again here to say, they must come here. And that should maybe will take 6 months or so, and you want a business now. If you are interested in getting a loan, go. They have sales consultants there. They have consultants that will talk to you and tell you exactly what is it that you must have. And I think I've spoken about Mesara, and there were questions that came from group 2. One was requesting that we must change the nature of CSD. We can't. These things are like you saying that a murder must not be a crime. We can't do that. Any rules and compliance related programs and policies, unfortunately, is something that we should follow. All we need to do, and I'm saying this because one of the problem or mistakes that we do is to overpromise and say things that are not real. If you are in that space, go and learn about CSD. Take time. What is it that I need? How can I be in this CSD list? It's a responsible thing. But I'm not going to say that, hey, the department will change. That is impossible. We're not going to change anything. But we can only empower communities to fit into the government system. Issues about land issue, ma'am, I think you are referring to the zoning. And I think you've got a municipality here, Tshwane municipality, they deal with zoning, that this area must be for churches. This place must be for business. And again, the submission that has been made by Mr. Kumalo at the back there, it speaks to a number of issues that I spoke about when it comes to GEP. And maybe we'll have an argument as I'm leaving here. I believe West Honoria Clinic is big. It is one of the biggest clinics. Maybe, that's why I'm saying I would take this one outside with you. Maybe we'll play with our phone and Google and see, or even drive together there. Marozos Buyela. So, because I stay on that side. But I believe the clinic is big. And also I think the issue that was mentioned again, the last question, it talks to red tape about GEP. And I think a community, really, where we require funding, where we require tenders. And I'm here, as I've been called, and on behalf of the department, to respond on this matter. Familiarize yourself about the industry that you want to work in. It's kind of difficult because we must do service delivery work. There's really little time to say, we're gonna come back and teach you how to make a proposal. But if you stand up and go and say, how can I make a proposal? Go to that department. There are people in this department that are only employed to do what is called advisory on operations. So, Chair, I think that is the end. I think I've covered all the questions. Thank you.
Thank you very much, Mr. Ndima, for those responses. From us as a committee, we will compile a report and make follow-up on the issues that were indicated in this meeting. We will continue to do oversight over the Department of Health, like we normally will be doing, to ensure that those areas that are important to our communities are brought forth. We hope that in future the GEP will be invited so that we understand some of the processes as they are not well understood by everybody. We are also interested when the road shows are coming. We wish the committee can be involved because these road shows are important for the community to learn and benefit, especially on the issues of the skills. We will also work together with the economic development. We will meet with the chairperson of the economic development and rural development so that we can see how we can assist our communities. Otherwise, some of the issues that were raised, they are for municipalities and some do not fall under the topic that we put forth. We have come to the end of our meeting. I would like to take this opportunity ke le lebohe gore le tlohile la itshwenya tsa mo meeting and le file di input, all those inputs that you have given. Dilo thusa ge re ngwala our report because we know what is needed. There is a need for education like Mr. Ndima has indicated. So, really, Leboha, you must drive safely when you go back home. There is lunch. Please sit where you are. Don't move. Lunch will be delivered to all of you. I want to thank you, honorable members, for taking your time to be in this meeting. I want to thank you, our officials that are working with us to make the committee work to be better. And I want to thank Mr. Ndima and TTT Baloi, Mr. PT, and Mr. Makola for coming to this meeting. We thank you very much. This belongs to that table, and Ibereka only here. Can you sit down and they are coming to collect them? You mustn't take it because it won't work. Ibereka only with that system. Thank you.